Thank you very much, Madam Moderator, for that gracious introduction. I'd also like to thank the organizers of ISAMS 2019 for this opportunity to bring to you our experience with acupuncture and moxibustion in the treatment of sports medicine in the Philippines. So I hope I will make this as dynamic as possible because this is sleepy time. It's right after lunch, so I hope you had your coffee. Okay, so I have no disclosures. I am the medical director of a center that offers this treatment, and I am a consultant for sports nutrition in the 2019 Southeast Asian Games. Okay, so I'm an orthopedic surgeon specializing in sports medicine, and what brought me to this kind of integrative practice is because I have to enhance the performance of my athletes without giving them drugs, without giving them ergogenic substances. So these are some of our athletes. And sports injuries defined as injuries that occur, of course, during sports, athletic activities, or exercising. So this does not limit itself to those who are professional athletes, but also we deal a lot more with our what we call weekend athletes, those who indulge in sports on the weekends after work. 21% of the injuries observed in elite college athletes caused the athlete to miss at least one day of sport or at least one season of sport or training. And more than 3/4 of those injuries involve the lower leg, the ankle, or the foot. So we will focus on those areas with our treatments this afternoon. Most commonly, we see these injuries. If you can see this volleyball player landing on her knee in a twisted manner. Worse on this one. This two athletes 2 years ago and 3 years ago ended up with an ACL sprain or ACL tear. So in sports medicine, we deal a lot with those. And in this study published in 2016, this is a very good evidence-based complementary study published in that journal. And they took a look at a survey of Korean national volleyball team players. And in their study, they found out that most of these injuries involve the knee and the lower back. So both acute and chronic injuries involve both areas, and we see a lot of those in our athletes. But in this publication, acupuncture is the most used treatment together with tuna. And physical therapy and taping is only second. But in our center, in our country actually, this is the opposite. We see a lot of patients undergoing physical therapy and taping, and we're only beginning to make use of much acupuncture and moxibustion as well. So in conventional sports medicine practice, we always say rise or rest, ice, compression, elevation, and we try to avoid using heat, alcohol, presuming exercise early, and massages. But more and more, we try to veer away from this. So in my personal practice, I use a different approach now, wherein I mix a combination of the West and the East treatment modalities. For example, for rice, yes, obvious that rest is needed and elevation can be helpful, especially in draining venous blood from the extremity. But what Oriental medicine taught us is that we take a different perspective as far as ice and compression is concerned. Ice is rarely used in Oriental medicine. The aphorism or the saying that ice is for dead people is still very, very, very much true, and that explains this perspective. In Chinese medicine or Oriental medicine, it is rarely used after the first 24 hours. So after the initial or acute phase, we rarely use ice nowadays in mixing East and West treatment modalities or treatment approaches. They say that ice or cold contracts the blood vessels, stagnates and congeals blood, and fluids, which in turn slows down healing and can lead to a long-term residual pain or chronic pain. And this eventually develops into arthritis. Using cold modalities, even in the acute phase, constricts the blood flow or the qi, and this delays healing. On the contrary, we are now using herbal ice, such as the the yellow combination, which is the Diedajiang ointment, which we use in much of our athletes now. Compression is usually when we apply elastic bandage to limit the swelling of the limb. What this does is that it stagnates blood and fluids and usually pushes the beginning mediators of healing towards the edges of the bandage and not in the injury itself. So we don't use this as much anymore. So until about half a decade ago, I never used acupuncture in my practice, but now I use it a lot. And acupuncture is a tool of Oriental medicine, of course, as we all know, by which tiny solid filaments are inserted into the skin at strategic points, or we call channels or chi points, to help the body heal naturally without drugs, surgery, or side effects even. Oriental medicine is a system of internal medicine where we can use acupuncture from treating anything from headaches to fibromyalgia, as was discussed yesterday and this morning, and diabetes even, or metabolic disorders. A branch of this, the Dieda or hit-fall medicine, was originated in ancient China, and this is used to treat injuries that martial artists develop or succumb to. It quickly and effectively addresses trauma to any part of the body, given all the right channels or chi points. So I routinely use a tube in my practice of acupuncture, and this is so because my patients are able to accept the practice much better, and they experience the least pain or discomfort. I use angulation technique, the 90 degrees or perpendicular technique for deeper muscular tears, the 30 to 50 degree angulated technique for bruising or tendinitis or fasciitis or inflammations of the fascia level. And for subcutaneous bruising or hematoma, I use the 5 to 15 degrees angulation. I also use rotatory frequency modulations and axial frequency modulations in my treatments. So these are the 6 points that I use in treating knee injuries, both in the acute phase and the chronic phase. The yin ling quan, or the yin mount spring, I'd like to remember the English term for this because it makes me or helps me remember them better. I use this for knee joint pain. So this is mostly in the middle side of the knee and addresses pain around the area of the knee and edema around the area of the knee as well. The shui hai, or the sea of blood, pain on the inner aspect of the upper thigh, and referred pain from the knee as well. Most of my patients with ACL injuries, I find this very effective since they feel the pain mostly on the upper part of the knee and the back of the knee. The Liang cube, or the ridge mount, I use for knee pain as well. This is swelling around the knee joint. Mostly for acute phase injuries. And for chronic ones, I use the doobie or the calf's nose, swelling and pain in the knee joint. The Zhusan Li, or the leg 3 miles, is for pain and limitation motion of the knee. So this is more for chronic pain and chronic instabilities of the knee. This also addresses numbness of the lower extremity. This is a point about 3 kuns from your ST35. The Feng Long, or the abundant bulge, I use very effectively for knee pain and for those that have cramps in the area of the sport or in the field. So this is a very good treatment modality for those who develop cramps of whatever reason, be it electrolyte imbalance or muscle fatigue. The Yanling Quan, or the Yang Mount Spring, or it's a gallbladder channel, number 34. I use this for knee joint pains as well and knee swelling. This is very effective for recurrent swelling of the knee for those who have meniscal tears and patellofemoral syndrome. The Tiao Ku, or the lines opening, is for lower leg pains and pain referred from the knee. So this is about 8 kuns from your ST35. For shoulder pain, I use 4 primary chi points. particularly for specific reasons. The Jianyu, or the shoulder bone, I use for frozen shoulder, so this is more for chronic pain. This is also for limitation of motion and general shoulder pain. This is very easy to find because you have a bony protuberance above it. I drive the needle around 2 to 3 centimeters from the surface. The jugu, or the great bone, is for pain and limitation of movement of the shoulder joint and even the upper back and upper extremity. The Jianzhen, or the true shoulder, is for general shoulder pain and upper arm pain, particularly for those radiating to the insertion of the supraspinatus tendon when you have rotator cuff tendinitis. And the Jianjing, or the shoulder well, is for those with the base of the neck pain radiating to the shoulder and upper back in between your scapulae. I use three secondary points for the shoulder, and most of these I use for radicular pain towards the arm. This is also what I use when the patient is generally not ready for acupuncture, as it is very common in our country. So the Sanjian, or the third space, is used to remove heat and inflammation that patients feel when they have impingement syndrome of the shoulder, or even when they have radiculopathic pain from the cervical spine. This is generally used for upper extremity pain. This is a very useful point for me, the Husi, or the backstream. This is for radiculopathic or referred pain, both for impingement syndrome and also for cervical spine. This is what I usually use in convincing my patients that acupuncture may be a very good option for them. And I can use this even when the patient is still on the consult table. So I hold his hand or her hand and drive my needle into SI3. And immediately, he or she is relieved of the pain. The Liekwe, broken sequence, is for lower arm pain referred from the shoulder particularly. This I find very useful for impingement syndrome, but not very much for cervical radiculopathies. Now for the ankle, this I usually employ on the field when the patient or the athlete goes down from an ankle sprain. This can be very useful. These 4 points can be very useful. So the heel of your ruins is for ankle sprain, which I put on the tip of your lateral malleolus. It also addresses swelling, stiffness, and generally cramps. So you can use this together with your knee channel points. The shining C is for cramps generally at the tip of the medial malleolus. This can also, on the chronic side, relieve water retention around the ankles, including swelling from knee injuries. The Kunlun Mountains, one of my favorites, is for ankle pain and for tarsal tunnel syndrome. Other lower extremities pain, including sciatica, which goes down all the way from the lower back down to the leg of the patient. And BL57, or support mountains, is for Achilles tendon stiffness and pain. May also be helpful for plantar fasciitis and Achilles tendinitis. As far as moxibustion is concerned, we use regular Korean moxa, and I'd like to flash this picture because I see this in Korean dramas. I think the title is Love in the Moonlight. So this is the lead actor with a wound in the back, and they're using moxibustion to treat the wound faster. So this comes from the Chinese traditional medicine, which consists of burning dried mugwort or artemisia on particular points in the body. I generally use this in my practice in combination with acupuncture because, as the talk this morning said, regular acupuncture points are linear and can be directed towards which side you want them. So this plays an important role in the traditional medical systems of China, Japan, Korea, Vietnam, and Mongolia. So as far as history is concerned, this is moxa or mugwort, Artemisia vulgaris. This was very clearly described in the Xianwu Lingji Lu in 1869, but we found an earlier publication by Valentini in his Museum Michirorum in 1714. So this may be a result of Marco Polo's travels in the 13th century. bringing this Oriental medicine therapy to Italy. The first attempt at supporting medical or evidence-based moxibustion was published by Haru Shimatoro in 1927 in his Iji Shinbun publication. This proved the effect of moxibustion in increasing hemoglobin concentrations and RBC count. So this evidence-based publication for moxibustion studies the effect on delayed onset muscle soreness or DOMS. So this was published in 2017 in the Journal of Sports Science and Medicine, and this actually raised a few eyebrows in our circles. But the results are very good in that it decreases the pain on the visual analog scale, both on the immediate and the 72-hour periods. It did not have a much significant effect in the isometric muscle strength after DOMS is experienced, and no effect at all in the circumference or the swelling of the extremity involved. But still plays a very landmark study for our practice. So this next study is on moxibustion and the treatment of improving vertical jump biomechanics. In this study, published in 2018, they subjected 50 athletes in exercise fatigue, and they used moxibustion to increase the activity rate in terms of jumping, and they found out that immediately after the fatigue-inducing exercise, a lot of those on moxibustion treatment were able to recover faster, being able to jump higher after the fatigue-inducing exercise was employed with moxibustion treatment. So in my practice, like I mentioned, I use this to combine with my acupuncture treatments, and it is to warm regions and meridian points with the intention of stimulating circulation over the local area through points and inducing a smoother flow of blood and qi. Most acupuncture points are recommended to combine with this treatment for directing the qi flow that they wish to simulate for treatment. So in this combination study, they examined the effect of the combination of acupuncture and moxibustion on shoulder joint pain, mostly chronic. And here they employed the study with equal number of cases, 29 in the observation group and 29 in the control group. Two of those from the observation group begged off because they did not want the treatment. So we were left with 23, and the results showed that they have better response in the observation group than the control group. Shoulder joint increase after the treatment was continued for 15 days, and improvement continued over a 45-day period. However, it did not have much effect on the pain scores as compared to the initial treatment at 15 days and the control group. So, in summary, what I usually tell my patients whenever I have to convince them to go to acupuncture therapy is that the sooner is better. The sooner the injury can be treated, the better the outcome. Acupuncture frees the joints, the flow of blood and qi, and facilitates healing. If not treated promptly, they can still be treated with acupuncture, but they would be more on a chronic phase. Chronic injuries respond to acupuncture as well, but it may take longer with more treatments required. For how long acute injury, depending on the severity, can be addressed even right directly at the court site. And a more chronic injury tends to respond better, usually on a weekly period rather than a bi-weekly on acute, as compared to acute injuries. ICE is for dead people, so remember to only use this earlier than 24 hours. And seeking a Western diagnosis is important. So still do your MRIs, still do your x-rays, and make sure that there is no severe injury that you have to address surgically. Your acupuncturist can prescribe local herbs, topical usually, to increase the circulation locally. And some topicals can even stop bleeding, mend tendons, and even help the treatment of bones or knit bones. Listen to your body. Oriental medicine is based on common sense. As always say, it's logical. If it's not logical, then it doesn't make sense. You can initiate activity right after the patient feels better. And sometimes it delays healing, but most of the time it increases. And you have to go to a reputable acupuncturist. In the Philippines, we don't have a formal training for acupuncture, and most of those who employ this treatment have to be trained abroad, including myself. So I leave you with this plaque that is from Juan Antonio Samaranch. I found this in the 1996 Olympics in Atlanta, Georgia. It says, "Sport is friendship, sport is health, sport is education, sport is life. And what's more important is sport brings the world together, both West and East." Thank you.